Hello,
Nice to meet you.
nice to meet you.
How can I help you today?
Well, doctor, I've been facing some trouble toilet training my 3.5-year-old boy. His name is Ali. Ali has two older siblings, doctor, and they were toilet trained by the age of 2.5. So I believe Ali is taking too long, doctor, and I started to get concerned. I need your advice.
I see. So Ali's 2.5 years, right?
3.5, yeah.
Three and a half.
Mhm.
Okay, so he's approximately 1 year older than they were when they learned the toilet training. Is that correct?
I would say so, yeah.
Um, can you tell me how long exactly you've been trying to toilet train him?
Well, I would say a year and a half or something.
I see. Um, That being said, I believe he's still very young. Why are you worried about that though?
Because I believe he's a year late, doctor. As I told you, his siblings were toilet trained by the age of 2.5. He's now 3.5, so he's like a year late or something.
I see. I understand that, like his other siblings were quicker to learn, but he's still well within the normal range for toilet training.
Hmm.
But
Okay, so
that
this
being
is
said,
normal. Hmm.
this is somewhat acceptable. It is not serious.
Hmm.
However, we can
Hmm.
actually work together, so maybe we can help
Hmm.
get him better or quicker at the toilet training.
Yes,
Um,
please.
can I ask you a few questions before so we I can just get a good grasp of the bigger picture here?
Yes, definitely.
Has he experienced any other symptoms? For example, have you noticed that he holds his tummy, he's having any tummy ache?
I wouldn't say so.
Would you say the amount of times he passes his bowel motion is irregular, or is it
Ye-
just?
yes, yes, it's a little bit irregular, I would say.
I see. Have you noticed that he had any fever recently?
No.
That is good to know. Um, have you noticed that he might be having anything that might cause him pain when he's going to the toilet?
I don't think so.
That is good to know. So for the most part, there aren't any other symptoms aside from a little bit of an irregularity in the bowel motions. Is that
Hmm.
correct?
Hmm. Yes.
Okay. Can you please explain to me the different techniques that you use to try and toilet train him?
Well, doctor, I've been using the same techniques I used with his older siblings. I've been using verbal encouragement mainly. I've been trying to put him on the toilet at regular times of the day, but that hasn't been effective.
I see.
Mhm.
Have you used any other techniques or just these two?
No, just these 2.
Well, they are good techniques, but we can expand a bit on that.
Hmm.
Um, For example, you might try to attempt to use something like a reward. Example, get him a candy he likes if
Hmm.
he succeeds in going to the toilet for one time, for example,
Hmm.
or
Okay.
or take him out to something you like to get to eat something he likes, for example.
Hmm.
Um,
I'm gonna give it a try. What else?
Okay. Another example you can do is maybe you could use like a book and explain a picture book and explain to him what he is supposed to do.
Hmm. Where can I get these books from, doctor?
Um, we have some around here. I will contact someone to get you a copy of something like that.
Yeah. Okay. Thank you.
Another thing we have to avoid. But before we mention it, I need to ask if you actually did it. Have you been angry with him before when he doesn't go to the bathroom?
No, 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 doctor, not at all. No, of course
That's
not.
great. That's very great because we absolutely need to avoid um, yelling and something like that when he doesn't go to the bathroom. Studies have shown that this doesn't usually help. So it's better to be avoided.
Mhm.
Okay, so to recap a bit, you need to involve something like a reward system to get him what he wants, something he likes when he goes to the bathroom.
Mhm.
You might need to use examples with picture box to illustrate what he's supposed to do.
Mhm.
Um, Sometimes it can be also beneficial to involve his other siblings as
Mhm.
well.
Okay, sounds like a great idea.
Um, if all of that still isn't enough,
Mhm.
it is possible to simply explain it with a video. It
Mhm.
That is one of the simpler methods.
Mhm.
You can just go on the internet, and it will be easy to find a video
Mhm.
to explain what he has to do.
Mhm.
But
Okay.
the most okay,
Mhm.
people.
I'm gonna
Um,
give it a try. Yes, I promise, doctor. I hope this would help.
The most important thing, though, I believe we need to be patient with him. He is
Mhm.
still within the acceptable age for this, and hopefully, with a little bit of time, he will be excellent when it comes to going to the toilet. It
I
can
hope so.
sometimes be different and be a personal variation between him and his siblings and other types of people.
Mhm.
So, so that is still well within the accepted range.
Okay, that's reassuring, doctor. Thank you.
Is there anything else you're concerned about at all?
No, that's all, doctor. Thanks a lot. Thank you for your help.
Thank you.